we see during monsoon season is an increase in our floodwater mosquito populations. Water will stand in the desert for periods of time, and we'll see a lot of mosquito activity. Unfortunately, people will get geared in on the monsoon season more than anything else. And the reality of it is that the mosquitoes that carry arboviruses are actually present other times other than monsoon season.
We do take mosquito-borne illness very seriously. In 2021, Arizona had one of the worst mosquito-borne outbreaks that's happened in quite a long time. West Nile virus can cause death.
In 1999, West Nile virus was first detected on the East Coast. In a matter of 4 years, it had spread across the entire United States. So a lot of municipalities started vector control programs if they didn't have one, or they increased what they were doing based off of West Nile virus and how quickly it spread across the United States. So the thing about West Nile virus is, now that it's endemic to the United States, we don't actually have any immunities necessarily built up. There is no vaccine for humans with West Nile virus. Pinal County, we use a modified CO2 trap. That trap has a bucket hanging above it with CO2 pellets in it. Mosquitoes are attracted to our exhaling, the CO2 we exhale, so therefore we use dry ice CO2 to attract them to our traps. They come into the area where the fan is, they get sucked down through into the bag, and they can't get back out.
Our staff go out and they trap all throughout the county with a focus on urban areas where mosquitoes are going to encounter people.
We will bring it back to the lab. We'll speciate the mosquitoes to determine, are they just floodwater mosquitoes, nuisance mosquitoes that are not the type of mosquito that carry disease, or are they the vector mosquitoes, the ones that we're specifically looking for to test for West Nile virus. We will run those tests here in the lab to determine if they are positive. We'll be able to upload those results immediately to the Arizona Department of Health Services database.
So as we come into monsoon season, we're going to see a lot more rain. What we ask people to do is to help prevent that rain from making mosquito problems. So if you have a pool, for example, that is not functioning or that is drained, the rain may fill the pool and then it becomes a mosquito breeding hazard.
It's important for people to look around their backyards. Make sure that they're not collecting water. With the monsoon season, we need to make sure that we don't have containers that are capable of holding water. And if we do, either remove them or turn them over.
Monsoons are important for our environment. They're important for water in the desert. We certainly would not want a dry monsoon season. But we do want people to control what they can control in order to help prevent mosquito breeding and mosquito-borne illness.
Self-protection is key, and you need to use that self-protection for mosquito bites, but not just during monsoon season.
We ask that if people do go out when mosquitoes are present, that they use CDC-approved mosquito repellent. The key is the ingredients that are in the product, not the product itself. So we look for things that are approved, like DEET, which is one many people may have heard of, picaridin, or even oil of lemon eucalyptus.
Once West Nile virus became endemic in the United States in 2004, it's just a matter of each year. Your hoping is the numbers will be decreased, but there will always be West Nile positive mosquito samples in this lab and in this county as long as mosquitoes exist that are the species that carry West Nile virus.